This is the moment we've all been waiting for. It's time! Presenting the champion of the world, Hell! Wham Bam Benamino!
Yo, this is your boy, Phil Benamino, a.k.a. Wham Bam. And this is the show, the Wham Bam's podcast, which is about regular people who have done extraordinary things. And today's we got a special guest. She's been in nursing, and I'll tell you what, she is in the ER unit. She has seen some of the most incredible things that we don't think about. And we're going to learn a little bit about why she does what she does. She is a superhero. Has saved many, many lives, and continues to be in the grind every single day, regardless of the situation people are into. So I'm super, super excited to announce here today about her. Let me give you some fun facts real quick about her, though. Miranda Jordan BREH, number one, she is a registered nurse. She's PAL certified. She's ACLS certified, and she's an adult life support. She's a graduate from Kennesaw State University as well as Brennan University for nursing school. I can't wait to find out exactly why she chose nursing, but I'll tell you some stories. If you heard my episode 1, that you know what? She brought a lot of things to help me get through what I went through, and we're about to talk to them this day. Here she coming in right now. There she comes. Miranda, how are you, man?
I'm good. How are you?
I'm fantastic. No, I just wanted you to know, first of all, I just think it's phenomenal of what you do. And I never really had the level of respect for nursing until I went through my episode in Italy from episode 1 that I talked about, and how some healthcares don't take care of their patients and stuff, and realizing what you really do and how you do it is just phenomenal and stuff. So I just want to, first of all, say kudos to you and for all you do. You're a superhero.
Well, thank you.
You really are. So, let's talk about it real quick. How did you get into nursing? Like when did you realize that, hey, this is something I want to do? Because let's face it, it's not for everybody. Taking care of somebody, when they're sick, when they're bleeding, when they're coughing and they're sneezing, you got these germs everywhere. Like, why? What made you go into that field?
So first, I want to say thank you. Thank you for having me on.
Absolutely.
You guys are great. Absolutely love the Benamino fam. So why did I choose nursing? First off, I grew up in a home. I was the first college graduate out of my family. I always told my mom, I was like, I think I want to be an education school teacher. I want to be an education school teacher. I want to be a math teacher. Well, things changed. I did have 2 loving parents, but I was predominantly raised in the home with my grandfather, my grandmother, and my mother. My grandfather.
Shout out to Gramps and Grandma.
Right. Papa and Nini. Those are my people.
Nice.
So they were great. They took care of a lot of us growing up. I mean, Lola did too. She's there. Lola's my mom. But my grandfather went through an unfortunate event my senior year of high school. He was in the military. He was in the Air Force in Vietnam, served his time over there, came home. We were told it was due to Agent Orange exposure. He had something called myelodysplastic syndrome, which turned into leukemia and took over his entire body pretty quickly. Wow. His brother was 100% match, and they did a transplant with him, bone marrow transplant. We had hope for about 6 months. He was in remission. Things were good, and things quickly turned south. He rejected the bone marrow transplant. He ended up back in the BMT unit at Northside Atlanta. That is a very special unit. If you don't know, it's a locked unit. You can only go in gowns and you're dressed up. They protect these patients really well. So we were getting false hope that things were going to go right, correct, good. It didn't go good. He lost his battle fairly quickly that time. He lost his battle in December of 2014. God bless him. He's a good man, but he is the reason I became a nurse. I went to Kennesaw State University for the first 2 years of my college career. It's about 20 minutes, if you don't know, from Northside Atlanta. So on my lunch breaks, I would go spend them with my papa.
Wow, that's awesome.
Yeah.
First of all, I apologize. I'm sorry for your loss. Of course, that must have hit home very hard. But you know what? Something good happened from it all, sounds like. So, I mean, think about the lives that you're changing right now, currently. I'm sure he'd be super proud of that and stuff. So
Yeah, he's a good guy. I actually still have a voicemail from him the day he got transferred to hospice. I have a voicemail of him telling me I can do it and he's living the dream, and it'll be even more of a dream when his granddaughter becomes a nurse. So he 110% gets all the credit for me going to nursing school. I hunkered down my first 2 years at Kennesaw. I kind of felt lost after he'd passed away, but I spent many time in the hospital and I talked a lot with these BMT nurses. You know what? Nurses, you guys say are superheroes, but let me tell you something. Cancer nurses, oncology nurses, they're a whole different level of certification.
right. Let's talk about this real quick, because there are different types of nurses and stuff.
Right.
And a lot of times people think of a nurse, they think of somebody just going to come in and take your time, your temperature, they're going to check you, they're going to take your vitals and stuff, and they're going to move on.
Right.
But there's so many different other types of nurses and different departments as well.
Yep.
Like an ER nurse. I mean, when you see people come in the trauma unit, that are going through a major accident or could have came off an ambulance and got in a car wreck or anything to that sort, it's pretty dramatic. What other different levels of nursing and what distinguishes one from the other?
So there's a couple different types of nursing. There's actually millions, let me be honest. There's critical care. Critical care can range from something as small as a med-surg ICU, and I don't want to say small, I mean not as intense. There's med-surg intensive care unit, there is surgical trauma ICU, there is neurotrauma ICU, there is neuro ICU, there's med-surg. Med-surg can be broken down into neuro med-surg, it can be broken down into oncology med-surg, GI med-surg, then there's emergency medicine.
Okay, freeze right there, because you already overloaded me.
Yeah,
So
there's a
there's so many different types and levels.
Correct.
Now, do you have to get different certifications for each individual one?
Absolutely not. When you go into each field, they kind of put you through something called a residency. Mine first with critical care was 18 weeks. I went through an 18-week program, had to follow a critical care nurse around. She followed me around. Then when I switched to emergency medicine, I had to go through a modified one learning emergency medicine. There's completely different types of tasks in those two types of nursing fields.
Wow. And what made you get into the field that you're currently in?
So I recently left critical care. I was in critical care for 4 years as a
No,
nurse.
let's talk about critical care real quick.
Yeah.
Explain to me and to the listeners out there today, in critical care, what exactly are your job duties? Like, what kind of patients are you dealing with and stuff?
So not always is critical care patients that aren't breathing and not talking. Sometimes we get patients that just have to be monitored closely, say after a heart attack, and they go in and put a cardiac stent. Sometimes we need to watch them and just make sure for the next 24 hours that everything goes well. We're also there to monitor patients that are on machines that are life-saving measures. That would be something so-called a ventilator, as you guys hear sometimes, is life support. Mm-hmm. We also take care of machines that will keep you on continuous renal support, so patients that are in complete kidney failure. There's also beds that look like spaceships that will flip you on your tummy to help prevent your respiratory stuff. So a bunch of different tasks.
Wow. And you have to be up to date with all these types of things. And these are things that people don't realize.
Yeah.
The person that's going in there, for stitches, or the person that got sick or so, like, they don't realize all the other things that are happening right there in front of your eyes.
Yep.
How do you deal with that? Like, I'm sure there's been occasions where people have come in, not even people that loved ones, kids, younger kids and stuff. That's going to be hard seeing somebody that's really struggling and trying to do all you can to help them.
Yeah, absolutely. So more so in emergency medicine that I'm in now is where you come in, you have a patient, that could come through the back door with an ambulance. Like you said earlier, trauma's coming in the back door who's cardiac arresting, but we have a little kid coming in the front door that is also very sick. There's something in emergency medicine that's called triage. So we triage patients based on the acuity of what they are. So the acuity of their symptoms and kind of, what nursing, tasks they're going to need. Are they going to need an IV? Are they going to need IV antibiotics, IV medications? Can they take oral medications? So it depends on.
You talk about medications there, and you know what? I got to be honest. First of all, big thank you to you. When I was in Italy, I know Kylie and them, they were reaching out to you and stuff and trying to get our information about what are they giving Dad? What is the stuff going to him? All the medicine, like you're a doctor. Like, it's amazing how much that you know about each individual medicine stuff. How long did it take you to learn that stuff?
So in nursing school, you take one course, 1 4-month course on pharmacology. That's it.
Okay. So you pretty much self-learned the different things through trial and error and being around it and stuff.
In critical care, I would say taught me a lot about my medications, because I never will give a med if I don't know what it's for. Because if you as a patient come in and ask me, why am I getting this? If I can't tell you, do you really trust me? Absolutely not.
Right. You know what? And that's one of the reasons why you're on our show today is because you literally take your job serious. You're there to help people. And I'm not saying other people don't,
Yeah.
but there are some people that it's just a job. Let's face it. They're punching in, they're punching out. You know, they're trying to feed their family. They're trying to make amends, and that's what they're doing. And then there's people like yourself that go above and beyond to try to say, listen, I don't want to just be a nurse. I want to be the best nurse I can possibly be. You know, so, you know, that being said, obviously there's scenarios and stuff that, you know, you can help. Talk about one of your most exciting, you know, moments as a nurse and stuff for you while working in the hospital.
Probably one of my favorite moments. You know, I see a lot. I've dealt with a lot. Depends on if you want sad, happy, whatever you want. But I'm going to go with my happiest moment. So I had a patient I got really connected with in the intensive care unit. The biggest part about intensive care is you love watching people wake up, and you love watching people come off those machines and make a stride and push, work with therapy, go from laying in a bed, say 5, 10, 15 days on a ventilator, and they wake up and they're walking. The most exciting thing is I had a patient one time, you know, I can't share too much because HIPAA, but they had an accident and they were put on the ventilator for a few months. The biggest victory is when they wake up. We slowly wake them up. We slowly allow them to respond to us. I woke them up, pulled the tube out, and they looked at me and they were like, I'm alive. Yeah, you're alive. Come on, let's go. Like, you're ready. That is the best thing, is when they're like, oh my gosh, I made it. Because immediately they're these medications are coming out of their system that make them drowsy and really not care. So that was such an experience to me, because they woke up and it was like, I'm alive, I'm ready. Watching them get up and walk. Watching them beat the odds. This patient was actually during the pandemic. So getting to watch him go from laying in a bed, his wife came in twice to say goodbye to him, to waking up and him just saying, oh my gosh, I'm alive.
That's awesome.
And he walked out of our unit.
That's awesome. That's such a good story. You know, one of the unfortunate things, I'm sure, though, with the pandemic and stuff, I'm sure not every story was happy.
Correct.
And, you know, share some of the experiences that you fell into, that you were a part of, that you didn't have any control over, and maybe wasn't the happiest moment.
I'll share one particular story. So during the pandemic, in the hospital, it was quite scary. It went from everyday nursing to, oh my gosh, the whole world is different now.
Right.
So we at one point had a family in our intensive care unit. Our intensive care unit where I work is 25 beds. It's not a big ICU, especially for the area that we live in and coming. So we had a mom, a daughter, and a father in our unit. All three of them were doing very, very critical. Critical being that they were all on the ventilators at one point during this pandemic. Youngest being 21, oldest being 55. We did everything. I can share a lot of stories from the pandemic. We would go from consoling families on FaceTime, which was so insensitive. What happened to families being at bedside, holding their family member's hand, telling them I love them, I care for them? They look up at me and I'm a stranger to them. They don't know me.
Right.
So I stepped up and I stepped in and I made these people feel like I could be something to them. I would remind them every day they're still loved. I understand you're seeing your family member behind a camera. But an unfortunate event with these three individuals is all three of them passed away.
That's heart-wrenching.
Yeah. So we took daughter to go see father first, as father was passing. And she asked us many times, am I going to die? Am I going to die? What do you do when someone asks you are going to die? I'm 26, 27 years old during this time. I don't know how to answer that question. I can look at you because I'm not going to give you false hope. That's one thing I'm going to tell you I'm not going to do in nursing. I'm never going to give you false hope. If I don't know, I'm going to look at you and say, I'd be damned if I tell you I do. I'd be damned if I told you you weren't. I'm going to tell you I'm going to fight with you. I'm going to stand right next to you. So this young individual, I colored with her. There were many days I would sit in her room. I would color with her. When we did take her off life support, let me tell you, there was a point she was strong enough that we were able to take her off life support for 3-4 days. She was doing okay. Just like a lot of the patients were doing good. We colored, we got her stuffed animals. We bought tons of things just to make her make that small little hospital room feel somewhat like home. We got the phone call that her mother was passing in the room down the hallway. And I asked her, I said, do you want to go see your mom? And she said, no, I'm scared. What do you mean? I said, I can't say her name, but I said, I'm more than happy to go down with you and let you say goodbye to your mom if you would like. And she explained, I'm 21 years old. What am I going to do without both of my parents? And I looked at her and I said, I can never answer that for you. I don't have that nightmare. I said, all I can do is I can stand here, sit here, hold your hand, guide you, love you, push you. You can fight this. Don't give up mentally, emotionally, physically. That is the biggest thing. When your mind and your body gives up, you give up.
You know, you're bringing a tear to my eye here because it's so sad and it's so real because that happened quite a bit. And it can happen any time. I mean, I kind of experienced that, like I said, months ago in Italy. You know, I thought my life was over. And it could have been. You know, I was fortunate. I was one to be able to say, here I am.
Correct.
You know, still not 100%, but, you know, I'm moving forward, you know, and continuing to, you know, beat some of these odds that were put against me. But again, you're a big part of that as well. You know, people like you is important. And, you know, it's important that people understand that there are people like you in the nurses. And I know not just you. I know you have a great core. Just being a north side up there myself, you know, a big shout out to that whole hospital because the way they treat you, so many times people say, you know, you go in the hospital and, you know, they're coming in there. The nurses are bothering you every hour. They're sticking you and poking you and checking on you and doing your vitals. They're waking you up and you can't get no rest, can't get no sleep. But the truth of the matter was after I was in the scenario I was in where I had nobody to care, I was okay with it. I was like, thank God somebody cares, you know, because the worst feeling is when somebody doesn't care. And unfortunately, you know, I experienced that too. And if those people don't think of it like that,
Right.
that, you know, they sit there and go, oh, stop bothering me, stop this. No, you really want that.
Yeah.
You want a nurse that cares. You want somebody that's bothering you. You want somebody that's treating you like they treat their family member. And ultimately, that is your family. Let's face it. You're at work a lot more, I'm sure, than you are at home.
Yeah.
You know?
And I'm a workaholic too, so I feel guilty.
Yeah.
And I know my people are short. I know the patients need us. And you know what? I'll tell you this. In nursing school, I was taught one thing. Shout out to Rich, this professor. I will send this to him.
All right. Big shout out, Rich.
He looked at us in nursing school and he taught us, I want you to treat every single patient like yo mama.
There you go.
How do you want your mom treated in that bed? And if your mom wasn't in your life, he said yo daddy. Said yo mama. That's what he said. Every time you look at a patient and they make you angry, don't think nursing's easy sometimes. There's the patients that come in, hit, bite, spit, punch. We don't hit back. We're not going to. We understand you're in a state or, you know, some part of your life that you don't mean this. It just happens. But I try to treat every single patient with utmost respect because I want to be remembered for good things, not bad.
That is such a great story to hear, and a big shout out to Rich.
Yeah.
Because I love that. And that's absolutely correct. So, first of all, we got to take a moment here to thank our sponsor, Cost Plus Processing. Cost Plus Processing is a company that helps business owners nationwide eliminate up to 100% of your processing fees. Find out why they are the future of merchant processing. Call them now at 1-855-391-9190. That's 1-855-391-9190 today. Mention you heard us on the podcast, Wham Bam's podcast, and you'll get something special from them. Find out why they are the future of merchant processing. So, Miranda, getting back into the show here with you and stuff. You know, I had to wipe some tears and everything with some sad things. But, you know, you do deal with a lot of different emotions going in there and being a nurse and stuff. How do you balance that when you go home? You know, I mean, I'm sure some of that trauma is stuck with you. You know, how do you deal with that at home and stuff?
So I'm going to be totally honest. After COVID, the reason I left the intensive care unit is because I wasn't learning how to cope with that type of stuff. I'm recently married. Shout out to Phil for marrying me.
Hey, congratulations.
And I have a great husband who, thankfully, his mother was a nurse as well, so he kind of could cope. He would just ask, how's your day? If I wanted to talk about it, I'd talk about it. If I didn't, I would just say, you know what, let's have dinner. Let's not talk about it. But I started learning that I was not coping correctly and I was bottling this up, and it would almost affect me so bad that I would recognize I wasn't eating. I wasn't taking care of me. I quit going to the gym. I would lay in bed. That just tore me up. So when I left intensive care and went down to the emergency room, I actually got an amazing therapist. And therapy is never the wrong answer.
No, man. We had, our second episode. If you haven't heard it out there, viewers, make sure you subscribe and hit the, subscribe button and the alert button. But look at our episode 2, the mind doctor we had on, and we talked quite a bit about self-care and how the importance of it is and having a therapist. Nothing wrong with that. No different than going to a dentist for your teeth or a podiatrist for your feet. If something hurts, you go get it fixed.
Absolutely.
And with the mind, something's going on with the mind, you go, in this case was the mind doctor.
Absolutely.
But you go see somebody and you get to be able to, get that stuff worked out. So kudos to you to be able to do that.
A lot of people, I think, too, feel that therapy is weird and that it's uncomfortable. It's supposed to be uncomfortable. You're sharing parts about your life that you're most vulnerable.
Isn't all help uncomfortable, though? Let's just be real. When you're not able to do something, it's uncomfortable.
Correct.
When you hurt, it's uncomfortable.
You're vulnerable.
When you go into the hospital, you go in the ER room, they're uncomfortable, right? I don't think you've seen anybody that was actually felt good, right? Felt good about being there, felt good about themselves.
Yeah.
It's an uncomfortable situation, but you want somebody to help you so that you can start becoming comfortable like you do in the nursing. So therapy, I think, is the same. So it's good that you do that. Now, I know that you recently also being married and stuff, you also have a business as well.
We do have a business.
So, you're a little entrepreneur on top of the nursing and stuff. So now you're running a business too. You're doing the books and everything else. Yep. Shout out to Off Leash Canine, North Georgia, Off Leash Canine, right?
And Cost Plus Processing.
Yeah, you're doing them both right to the sponsors. But the reality is, it's a lot to juggle.
Yeah.
So how do you balance everything?
So first and foremost, it's crazy you asked that because that's something I kind of talked about in therapy with my therapist. I was like, I'm a nurse. I have emotional factors here. I'm a wife, and now we're business owners. So my husband and I opened Off Leash Canine last year of May. And over the last year, I can honestly say trying to learn to balance is an education. It's education every single day. I'm learning something new. But something I do is Tyler and I always make sure we take nights to ourselves to separate from everything. We try to do date nights where it's just the two of us. We talk about nothing. We challenge each other to not talk about it. Because sometimes that's what your life becomes, is talking about, your business and your...
Good advice. Good advice. Nothing wrong with that. So,
yeah.
Getting back into the nursing field, being there, we talked a little bit about some of the scenarios that you've seen that were hard. What happens when you have somebody there that that you just know who they are, family member, friend, somebody that's special to you? What do you do in those scenarios, especially if things aren't going so well?
Okay. My first patient that I ever lost was a good friend's father. Up in the intensive care unit. And that was really hard. Are you asking how I separated myself?
I bet. Well, a scenario like that where it's like you're the nurse and you can't do nothing. Like, I find it hard. I like to help a lot of people and stuff out there in the world. And that's what this podcast is all about as well, reaching more people. But when you can't help somebody and you're trying everything and there's nothing left for you that you can do, it wrenches on your heart.
So I absolutely never tell someone I can sympathize with them because I don't walk in your shoes. I empathize with you and I walk parallel. So if I can say I can understand something, I just say, I can empathize with you. I'm not in your shoes, but let me try to help. During this situation, I took my scrubs off. I put on my street clothes and I sat there. I sat there as no longer a nurse. I'm not a nurse in this standpoint. Let me be your support.
That's awesome. That's awesome. See, that's what makes you so special. Okay. Because not everybody would do that, to sit down and say, okay, I'm taking my scrubs off. I'm no longer your nurse. I'm now your friend.
Yeah.
And I'm here to support you and to be there by your side. We talked about this also in episode 2 about walking in your shoes. It's like, even if you were to walk in my shoes, they're still not your shoes.
Correct.
So you just don't know. And even if they fit you, they're still not your shoes.
They're not formed to your feet.
So it's like everybody, goes through something that's challenging. I wish more and more people were like you and had that, approach and stuff. And I guess that's what makes you so special and why everybody loves Miranda. That's the one thing I found out being in the hospital. So everybody knows who Miranda is. Everybody loves Miranda. Everybody wants to see Miranda. And somehow you do it. You get around to these patients. You make sure you pop your head in and you see them, even if they're not in your wing. I know, even myself, you came in, you weren't even working. Your shift's over, but yeah, you're still coming in and checking and stuff. And, it's, you take pride in what you do. And do you see that with other people that are in the hospital as well?
So I do, but I don't. I mean, let me tell you something. I'm really going to be honest. The pandemic changed a lot of nurses. And that's really what I can take it back to. I saw people who were empathetic, compassionate, loving, fierce. They just every day, blood, sweat, and tears nursing turned to stone cold people.
Right.
I mean, especially in the emergency room and critical care and the pandemic floor. There was a floor specifically for those patients. So I'm just going to tell you, yes, I do see it, but it's less than what I saw back in the day.
It's got to be super hard knowing that every day you're waking up and you're going into a scenario. I mean, I think everybody has those days where you just don't want to go to work, right?
Absolutely.
You know, you wake up, everybody says you wake up on the wrong side of the bed or
Yeah.
whatever it may be. You just don't feel like it today.
Absolutely.
But you know what? That's not a job where you can sit back and say, I just don't feel like being a nurse today. I don't feel like taking care of somebody, because that's what you have to do. And unfortunately, there are some cases that require a lot more attention than others.
Yes.
You're in ER and you got somebody coming in and their leg is hanging, and stuff, and you got to perform surgery or open heart surgery or something like that where, there's questions. These people might not make it out alive and stuff, and you have to deal with that. You have to deal with the families and the people that are around it and everything else. It's got to be a hard thing.
Yeah. Yeah. I mean, let me say too, you asked me about when people come in that I care about and love. I kind of take on the role of what you want me to take on. So, with you, when your family was calling, I know my place. I know that I can be aggressive. I know that I can help, and I know that you guys will appreciate it. I also know, like you said, when do I learn to take off the scrubs and I'm no longer a nurse, I'm your friend. I have to read the room. Sometimes in my scrubs, for families when we're now finding cancer and we're in the emergency room and I'm telling them with the doctor, I'll go in and I listen to these conversations. The doctor steps out. I stay at the bedside. I'm like, what can I do for you? Do you want me to be a nurse or do you want me to be your friend? I'll hold your hand. I'll do whatever. So something about me that I hope I never lose, and I do pride myself in this. I can never say I'm full of myself, but I'm confident in the fact that I am compassionate and I better never lose it. And when I do, I better get out of nursing because I pride myself. You guys aren't there because you want to be. You're there because you need to be. I'm there because I want to be.
Right.
There's this difference.
But you know what? That's a beautiful thing, because they, doing what you do and wanting to do that is not for everybody. And I do believe God puts people in certain areas that they're good at.
Absolutely.
And they're special people. And that's, like I said, that's what this show is all about, because you don't have to be a professional athlete or make millions of dollars to be special.
Yeah.
And the things that you've done, shown, and not just to myself, obviously I've seen it personally, so I could stand up and say, yes, this is true. Now I will tell you this: when I was in Italy, I was screaming your name and you didn't show up for some reason, but
there was no plane to pick me up.
I know, but I'm thankful for the FaceTimes. I'm thankful for the FaceTimes and give me some direction and some hope and stuff. But the reality is, I hope that people are getting into nursing, or that people are trying to look for a job out there, people are trying to find a way, that they really understand that nursing is a very rewarding job.
Correct.
You know what I mean? Also, if you do a good job at it,
Yeah.
you know what I'm saying? And I feel like there's not enough. I mean, how do you feel as far as that goes?
So there isn't enough nursing. I mean, recently we can't give out wait times at the hospital because, just like you said, we don't know what's coming in the back door. I'm sorry, but I know that if it was your family member coming in the back door cardiac arresting, you would want them seen before someone else.
Yeah.
So we don't know. But what I will tell you is it goes back to, if I don't show up, you said, there's days people wake up and they don't want to go to work. If I don't show up, guess who suffers? All of y'all who are in the waiting room waiting. I take 3 patients to one nurse. I take 3 patients to one nurse in the ER. So that's 3 patients that are now sitting out there with a longer wait time because I just didn't want to show up. So
see, and I think as the patient coming in and a family member of a patient, we're greedy, right? We have one person to think about. We're thinking about ourselves.
Correct.
We're thinking about ourselves, and you have tens of thousands of people in that hospital to think about. And like I said, your group your floor might be 30 people or 40 people or 50 people. But you have to deal with not just the patient, but also the patient's families, and the patient's doctors. And I just know for myself, I didn't have just one doctor. I had 6 or 7 different doctors coming in. So
that's very true.
You're trying to balance each doctor and understand each one, what medicine each one's giving them and what it's for, and making sure it's not counteracting something else.
Correct.
Because a lot of that happens, right?
Correct. You also have pharmacy on every floor. There is one pharmacist that sits on every floor, and every medication that's ordered goes through their desk. So that's why it's always important we ask allergies too. But I mean, something can be missed, but you don't just have one thing to worry about on one patient. You got 10, because if you do one thing wrong and your life is over, come on, that's a simple mistake you made. So I mean, it's crazy. You are right. We do worry about families, and people say families are the problem. No, your family knows you best. I've always preached that. Your family knows you best.
It's true. But again, families, we're selfish. You know what I mean? We think about ourselves.
What's the wait time? How long are we going?
Yeah, we're not thinking about the person in the room next door.
Correct.
Who's, like you said, is under a cardiac arrest, and if he doesn't get treated, they're going to die right then and there. Yeah. I think people need to be more aware, and I hope listeners today can also become a little bit more compassionate when they go into a setting like that, but also be thankful for the nurses and the doctors and stuff that are there taking care of them and giving them what they really, really need, because it's a thankful job and an unthankful job.
Very much so.
You know what I'm saying? And it's a happy job and it's a very sad job.
Yeah, very much so.
We talk about, the different heroes in today's world, whether there's veterans that have fought for our country, there's firemen that, go in the fires, there's policemen, they get, taking on the bad guys and getting shot and bullets over their heads and stuff. But there's nurses, like yourself, that also are dealing with trauma, dealing with, trying to save lives, trying to keep people, alive and here today. And unfortunately, some of the families probably aren't the easiest.
Yeah, I also think too, if I could say one thing and it be heard, is we're human too. So when I do go from one room to your room, it's very hard for me to sometimes compartmentalize within 1 minute of saying goodbye to someone and walking into the next patient's room. Is, we're human too. We have feelings and emotions too, and we're expected to put them on the back burner immediately. So when I come into your room and I'm like, look, listen, there was just a really serious medical emergency. If I'm ever your nurse at Northside Forsyth, know that I mean it, because you are just as important to me as that person was. But that person needed me more in that moment. So turning it off, going from, emotional to now supportive to the next person, it's hard sometimes. So give us the time of day and know that, like I said, we are human too, and we are doing a lot, but not to say that you aren't either and your family's not hurting, but it's hard sometimes going, like I said, from death to supporting the next sick patient that needs me.
I don't think death is an easy scenario. I mean, just using my own experience, losing my father, even, 6 years now, he's been gone. He was my best friend, and it's been hard. I'm still grieving. Still grieving. I can only imagine seeing people that you're dealing with every single day, and you lose them. They're there today, but all of a sudden they lost that battle, and tomorrow you go show up and they're not there anymore. And you're like, hey, where is, so-and-so? And you find out they passed overnight when you were at home, when you were off shift. That's got to affect you too in a certain way, to like, holy cow, even things that happen sudden. I'm sure you've lost some people that you didn't think they were on their deathbed, and the tide turned throughout the night. And that's got to be a horrible feeling, going in, looking for somebody, and then they're not there no more.
So in critical care, we got more of that continuation of care. That was part of the reason too why I had to move to ICU, because I got very self-involved. I would take care of the same patient for 3 nights in a row. And guess what? What happens at the end of those 3 nights? I don't know. I don't. So I, like you just said, I would go home, be human, and come back to my next shift. Say if it was a day off, 2 days off, we don't have set schedules. We get to make our own schedules. So sometimes I'm off 3, 1, 2. It doesn't know. I don't know. So I go back in, and like you just said, they're gone. And I spent 3 days busting my butt, holding hands, sitting at bedside. And you're like, I did everything I could. Was there one thing more I could do?
Mm.
That is the question that I suffer with the most. Was there one thing more I could do? I don't know if people know this. It's probably not common knowledge unless your family member's been in the one in the bed. Before we call a cardiac arrest, the doctor asks, are there any stipulations? Does anyone disagree with the thing? And anybody can speak up in that room.
Mm.
But I can tell you, I've never once felt like I watched a patient suffer or us do any harm to them. We're always there to save your family. We're always there to do the best thing for them. We're always there to do what they wanted. That's why wills come in play, and why they take such importance in these type of scenarios. But like you said, I can care for someone for 2 or 3 days and come back the next and they're gone, and that's hard. That's probably the hardest thing.
Yeah.
You build connection with family in 3 days. They're no longer just a patient or a number in the bed.
Right.
They're a human.
Right. Of course.
Emotions too.
Especially somebody that you see is getting better and you're helping and you're excited. And
Correct.
And then boom, it turns around. Yeah, that's got a horrible feeling. But, kudos to you to be able to, separate and understand that, hey, this is part of what I do.
Yeah.
The truth of the matter being, I want to be the first to tell you that what you do on a positive way is way more than anything that happens to you on a negative way. You may not feel that way, but I can tell you as an outsider looking in, I appreciate, and I'm sure more people that are listening to this also appreciate how you handle yourself as a nurse and stuff, and understanding the battles that you have to deal with on a daily basis to be good at what you do.
Well, thank you.
Because, like I said, we could talk about a professional athlete. They have to practice every day. Practice is tough. It's sweaty. It's hard. That's what they do.
I couldn't do that.
You know what I'm saying, right? You can't do that and stuff. Everybody's got their own thing. Salespeople, they go out there, they sell every day, they get rejected. It's a horrible thing. Trash people, they pick up trash. They smell like garbage at home. And so, it's what they do.
Yeah.
Unfortunately, you being a nurse, like, you're dealing with some happy times, but you also have the bad times too. And it's unfortunate, but not everybody makes it out of there. So I'm thankful that there are people like you and I wanted listeners to know that there are nurses and people like you out there that are working extremely hard to make their loved ones, come back out, in the most healthiest way. And if they can't, you're providing them an opportunity to be a family-like supporter, and understanding the circumstances that they're in, type of thing.
No, I mean, nursing, you know what? Like you said, when my friends come in, I'll do anything for you. I'll try my best to get you back. I'll do anything I can for you. And like you said, I will stay late. I'll change my clothes. I'll do whatever you need. I'm not just a nurse. I'm also a friend and a family member too. I promise.
That's great. Miranda, one last thing. People out there today, guys, girls, they're looking for that. They want to get into nursing and stuff. What would you tell them? What would you do to tell them to, as far as, the field goes and what to expect?
So if you are thinking about becoming a nurse, do it. So many people are going to tell you, don't, it's hard. It's this, it's that, blood, sweat. No, listen, I went into nursing absolutely petrified and scared of blood, absolutely petrified and scared of anything nasty, so to speak. We need good, compassionate people. And listen, if you hunker down for 2 years, not only is it going to financially take care of you the rest of your life, you're going to emotionally know that you've changed lives. And let me tell you something, the most rewarding thing that I've ever done in my life is become a nurse. And I don't regret those 4 years for absolutely anything. I'm a bachelor's of science in nursing. I went all the way. Love it.
That's awesome. Well, there you have it, folks. Listeners, if you're out there and you're thinking about becoming a nurse, or you're wondering what these nurses really deal with every day, I hope now, after listening to this podcast, you have a little bit more insight of the heroes that they really are. Miranda, thank you so much again for being here. Remember, subscribe to our channel, Wham Bam's Podcast. Okay, we're on YouTube. Make sure you hit the alert button so that you get all of our new notifications. We're out.
Bye.
This podcast is brought to you by Cost Plus Processing, the leader in merchant processing. Call 1-855-391-9190 and find out why they are the future of merchant processing.